Hello, everyone. Welcome back to my channel. Today, we're going to be talking about something called medical aid in dying, or MAID for short. I have a separate video that I will put a link at the end of this video that describes an overview of that procedure. I wanted to dedicate this video to two cases that I personally dealt with that may have benefited from the MAID procedure. And there are two cases that has stayed in my memory for quite a long time. I've been an intensive care nurse as well as an emergency room nurse for several years. And in the ICU, the intensive care unit, we take care of the sickest patients. And there were two cases where the patients were terminally ill. In one particular case, a mother who was the person who was ill and two daughters. So at the time of taking care of this patient, the mother was very sick and she had cancer. And at the time that I took care of her in the ICU, she was terminally ill and the cancer was metastasized into all parts of her organs. The interesting part of taking care of this patient was that the two daughters that took care of her, culturally, they didn't want the mother to know that she had cancer. And she instructed the healthcare providers, the nurses, doctors, anybody that came across their mother, not to discuss her prognosis, her case. So it made it a little bit difficult for nurses like myself to take care of the patient, because one of the things that we are taught is to advocate for the patient. And it was this kind of a strange feeling taking care of a patient who didn't know exactly what's wrong or what kind of illness that they had. In the last days of her life, she had admitted to the emergency room. After she was stabilized, she came to the ICU. I took care of her in the last days. She was in the ICU for the last time. Her body was decompensating. There was no more way of her body to take care of what she had. Her blood pressure was going down. She had what was called sepsis. Essentially, her whole body system, including her organs, were shutting down. And one of the things that we do in the ICU is put measures that are not what we call life-saving, but things that we could do to ease her pain, as well treat the symptoms like her low blood pressure. And as her blood pressure is going down, the protocol we have in the ICU is to give medication to bring up the blood pressure. And that is what we call vasopressors. And so usually it starts with one medication, and the medication will work for a while. But when someone is in the later stages of their life, they may need additional medications to bring their blood pressure up. And that was her case. And we added a second blood pressure medication and a third one. And usually, in my experience in taking care of patients in ICU with sepsis, where their blood pressure is continually going down, once they're in their third medication, it's usually a very bad sign that they're at their end stage, where they're physically unable to bring their blood pressure on their own. So medications are not doing anything. And if you're on your third medication, that's about it. We can't add any more. So the patient was in this state, and there was orders for her to provide CPR if her heart stopped, if she stopped breathing. Again, this is without the patient really understanding what was going on, because in this particular culture, it was better that the patient, or from their understanding, the patient didn't know what was happening to their body. And at this point, the patient was groggy, the patient was a bit delusional, and really not coherent as to what was going on. So eventually the patient passed away. And this was a patient that I started seeing in our ICU about 6 months. And this is an example that I see in terms of where does medical aid in dying fit in? Don't know when her disease process, when her cancer started metastasizing. This would have been a case where if a family members or if the patient wanted to discuss and see if that was their an appropriate path for them, but that wasn't discussed. MAID has been around in California, at least, for over a decade. There's only about 11 states that recognize MAID as that's legalized. In most of the states, you can't implement this process. But I wanted to also bring this up in my video to let the patients and their family members know that in certain states like Oregon, California, Washington, you can elect to look into this procedure and see if it's right for you. There's a long process of making sure that it is the right decision, provides the autonomy for the patient. It does require that your prognosis is only 6 months to live. It also requires that you are completely competent in making this decision. So those are two main things. And also have to find a provider that is willing to take on this with you. This is different than euthanasia. You do have to self-administer the medication. Another case that I wanted to bring up that might have been appropriate for MAID, and that is a patient who had lung cancer, what we call atypical, because the patient was a non-smoker. So we don't know where the source of the cancer came from. In this case, the patient who was in his mid-50s, he was taken care of by his wife. What's interesting about their case is that they lived in a different state. They came to California in the hospital I worked in for specifically to get a lung transplant, get better, and leave. Well, after the lung transplant, they never got better. And so they had complications one after another. And so they stayed in probably a year to the time that they were in the ICU multiple times. So they were in and out of the hospital. He would get stabilized and wait until he got better to release him to go back home. I'm not sure what his prognosis was, but he was very sick. Wife was who engaged with the healthcare providers. The patient was coherent the entire time. And the last time I took care of this patient, he was in the ICU. And because he was in and out of the hospital for such a long time, he had what we called an air mattress. And these are mattresses that the hospital can provide if you are in the hospital for a very long time and you are at risk for bed sores. There are studies that say that they help with lessening the risk for getting pressure ulcers. He had coded. When that happens, we need to slide in something that what looks like a board that you carry patients or transfer patients in order to do the CPR. He didn't make it. His wife was in the room the whole time. And that's something that we've changed over the years, is we ask the family members whether they want to continue to be in the room, same room as the patient. In those two cases, again, I think about whether MAID would have been better in a sense that would they have had more control of how things end. And if they wanted to end it that way, that's perfectly fine. But it does give patients who have a terminal illness of 6 months a choice of how they want to go. And I think that's a very powerful way to give the power back to the patient. But it does take a network, a group of people to support that patient in a way that they can make that sound decision of how they want to approach their last days. And I think it's a good thing to have, whether you want to do that or whether you don't want to do that, or you want to just go without knowing what happened. I think those are really good things, meaning that whatever is right for you is what you should do. But at least we have a process or procedure that you have total control over in that last 6 months. You know, personally, I don't know. I think if I came upon a diagnosis of something that is going to where my death is for sure going to happen in 6 months, it's a consideration that I might have of doing that, because, being in a hospital and dying in a hospital is really not what I envision having my last breath going. But some people want to ignore that part. Most people who do opt for the MAID are people who have cancer. And there's a lot of pain that goes with cancer. So I can understand that if you have some disease process that there is no turning back, that this is a calm, controlled way of going. I hope this video helps people who are in similar situations to at least start the dialogue, talking to your family members, talking to your healthcare providers, and also having a conversation with yourself. And one of the things I recommend is that think about why you are opting for MAID. And if it's just to lessen the burden of people around you, it's probably not the best choice. And it's not what this procedure was developed for. So those are things that you really need to sit down and have a conversation with yourself and your loved ones and anyone that is going to be part of your last days here. All right, I hope this video really helps and at least start the dialogue if you're in the space that this may help you. If you found this video helpful, share, like, and subscribe to my channel so I can bring you more health information and systems that is simple to understand. So I'll see you next time. Bye, everyone. Take care.